So I'm sure many of you out there, like me, are probably really interested in hearing, of course, some of the stats involving COVID when it comes to stuff like, if you're in a younger demographic, what are your chances of being hospitalized if you're vaccinated or unvaccinated? Or maybe based on, just again, stuff like age, your race, other demographics, prior health conditions, what really is causing the biggest impact when it comes to COVID? And, I would love to be able to sit here and tell you right now, if you get vaccinated at a younger age, you will be less likely to be in the hospital with COVID. I would love to be able to say this, but unfortunately, the CDC has decided to withhold that information just a little bit longer. Just a little bit longer. They're planning on withholding that information a little bit longer because they're worried about the data, being misinterpreted. Right? Right here, we got from the New York Post. CDC withholding COVID data over fears of misinterpretation. I wonder why they would be worried about that. I really wonder why they would be worried about that. Don't get me wrong. YouTube, before you sit there and claim that I'm over here spreading misinformation myself by saying, oh, we don't know the evidence for vaccination status and going into a hospital. Overall, yay vaccines. I love vaccines. I didn't get the vaccine. Me and my entire family here all got COVID instead. So we're all inoculated against COVID, which is good. But we didn't get the vaccine. My grandparents got the vaccine. I was very happy they got the vaccine. My mom got the vaccine. She's around a bunch of people quite often. So, hey, it's probably good for her to get the vaccine. But how am I supposed to make the decision for my family going forward without the information out there from the CDC? Because the CDC has decided to withhold certain segments of the data. So of course they sit there and will release the stuff saying 65 and over, you should probably get vaccinated, right? It's pretty clear. I think we all understand this. If you're 65 and over, the data all shows you're at probably more of a risk of dying of COVID than anything else. So, yeah, take the vaccine. Or talk to your doctor, I should say, because obviously I don't want to be giving out medical advice here. Talk to your doctor and see if you can't get a vaccine, because if you're in an older age bracket, you're at a very high risk of COVID. But if you're young, let's say between the ages of like 18 and 40 or so, you're a healthy young individual, do you need the vaccine? I don't know. My doctor recommended me not to get it because I already had COVID, so maybe there's something there. And I know COVID really wasn't a big deal for me, my wife, or even my kid, to be honest, who's only like 1 year old, right? It really wasn't a big deal for us. On the other hand, other people who I knew who were also quite young got really, really, really sick with COVID. Some of them were vaxxed, some of them were unvaxxed. They both got really, really sick of COVID, so who knows what it could be. I would like to be able to say, I would really love to be able to say if you go out there and get vaccinated, you'll have a less likelihood of being in the hospital. But the CDC has withheld that information from us. They've withheld that information from us, unfortunately. Now, more than likely, yeah, you're probably safer to get the vaccine than to get COVID, according to the data we got currently. But I would really like to see the data the CDC has to make sure that, trust but verify, as the saying goes. But, again, we got a story here from the New York Post, CDC withholding COVID data. So let's look at least a little bit of what they're withholding. The CDC has admitted it is withholding large portions of COVID-19 data, including on the vaccine boosters, from the public because it fears the information could be misinterpreted. The leading public health agency has only published a small sample of the data it has been collecting, despite being 2 years in the pandemic, sources told the New York Times. Kirsten Nordlund at the CDC, or a CDC spokeswoman, said the reason for the slow release of data is because basically at the end of the day, it's not ready for prime time. She added, and I wonder what ready for prime time means, just release the data. I wonder if prime time really means they have to find a way to present the data in such a way that gets their point across. Just thought. She added that the CDC's priority when gathering any data is to ensure that it is accurate and actionable. But another reason is that the data could be misinterpreted by the public, Nordland admitted. Among the data that has been collected and has not made public is hospitalizations broken down by age, race, and more importantly, vaccination status over the last year, and the information of the effectiveness of booster shots. We don't know how effective these shots are. We don't know what they're really doing yet. I want to trust you, CDC. I want to trust all the doctors around me. I want to trust the science. I truly, truly, truly do. So show me the science. Show me the data. That's all I'm asking. That's all I'm asking. I'm not saying anything bad about vaccines over here. Again, YouTube, I'm not saying that. I'm simply saying I would love to see how effective they are. I'm assuming that you're telling me the truth here, that they are effective. So let's see the work. Show me the work. Trust but verify. Let's see what the data shows. Because as far as I can tell, looking around, I got Omicron. Even though I had the Alpha variant, I still got Omicron. You know, I have relatives who were vaccinated who all got Omicron. Everyone who I know is getting Omicron, whether they're vaxxed or unvaxxed, it seems. So I would really like to know the effectiveness of the booster shots. I would really like to know this information. When the CDC released its data on the effectiveness of boosters for adults younger than 65 2 weeks ago, it did not include the number for those between the ages of 18 and 49. The majority of people who are in the workforce, who are going to be exposed to COVID at a higher rate than others. All right, it's insane to me. It's absolutely insane to me that this is. Just release the data. You have the data. You have the raw numbers. Just release it. If it's bad news, frankly, if you just release the bad news to me, I would actually trust you even more. I would probably trust you more. Okay? Just release the data. That's all we're asking. The data showed the booster shots were least likely to benefit younger adults because 2 shots of the Moderna and Pfizer vaccines and 1 dose of Johnson & Johnson already left them well protected. You know, it probably protected people from the Alpha variant, probably protected people from the Delta variant, which were the 2 deadliest variants, therefore vaccines. Hey, yay, good vaccines, 100%, woohoo. What about Omicron? We don't know. They won't release the data. They won't release the data for the boosters. They won't release the data for people in the age bracket that's going to be more than likely going to actually get Omicron because they're in the workforce at higher numbers. The CDC has only just started releasing data on whether COVID is present in wastewater. Even though some states have been providing figures since the beginning of the pandemic, wastewater data can help public health officials predict whether there will be an influx of COVID-19 cases. According to one CDC official, Dr. Daniel Jernigan, I don't know how to say that, the COVID pandemic has revealed how outdated the agency and other state-level health systems have become. Well, you know what, on that I can 100% agree. Right, let's face it, anything that's government run is outdated. So there we have, we have a full article here. It's not much, but again, it really gets the point across here that they are not being honest with us. That's all I want them to be at the end of the day. I just want them to be honest. I just want them to tell us what's up. Hey, what's going on with the data? What are people in my age bracket experiencing? What about cases when it comes to other pre-existing conditions like being overweight? Now I'm got a few extra pounds on me for sure. I'm about 220 pounds right now, so I definitely need to lose some weight myself. But when it comes to COVID, we do know that people who are obese typically have a harder time with COVID than people who aren't, right? We know people who have other pre-existing conditions like asthma are going to have a hard time with COVID. I have a friend who he's in my age bracket. He was very adamant about getting every shot, every booster, and all of that because he has asthma. And, his doctor basically told him, listen, he has some other stuff too, but, the doctor basically said, listen, if you get COVID, you're going to probably go to the hospital. So it made sense for him to go that route. He talked to his doctor, got the best advice, and followed through with it. I talked to my doctor. I told him I already had the Alpha variant. He said, don't worry about it. That's what my doctor said. Your doctor might say something different. But it's hard for us to be able to make these decisions with our doctors when the CDC decides to withhold the information that we would need to help make this decision with. Right now, we're doing this on blind trust. And I can say this, I don't blindly trust anyone. I just don't. Not anymore. Not anymore. Maybe there was a time I used to. I think the last time I probably trusted the government was a little bit after, 2001. And then I realized how crazy the government really was pretty soon after that. But I don't really trust them. I want to verify. Everything I've seen says the vaccine is good. Everything I've seen says the vaccine. I'm thankful Trump got the vaccine out so people who are at the at-risk categories can make sure they, of course, have some defense against this disease, because it is a bad disease. I know people who've died from COVID. I'm sure many of you out there do too. I know people who've died from COVID. It's bad. It's nasty. All right. I've known more people have gone to a hospital and barely made it. It's a tough disease, especially if you get like the Alpha or Delta variant. Omicron, I haven't really known anyone get anything really that bad from, but you know, we'll see. Hopefully we're at the dying end of this pandemic. I think so. It looks like it. But why are we not releasing the data? What would be the reason for not releasing the data? You can leave that in the comments below. Why would they not release the data? Because I can't say why on YouTube, that's for sure. I can't make any I can't speculate on YouTube, I should say. I can't speculate on YouTube because obviously that could get me in a little bit of trouble. So, you speculate for me. Leave in the comments below, why are they not releasing the data? As well as, of course, if you enjoyed this video, hey, leave a thumbs up. It really does help out a lot. And of course, if you want to watch more content like this, hey, subscribe as well. Either way, thanks so much for watching, and we'll be talking again real soon.